We are spending some time during his and his team's lunch hour. I'm talking about Dr. Stephen Marsh in his office right now. Doctor, thanks for spending this time with us. And your team, of course, behind you, still working hard.
Right. So it's supposed to be their lunch hour, but
Right.
people who work know you almost don't always get your full hour or 45 minutes. And so they're working, but it's a great team, Joe. We've been with each other 7 to 16 years, really haven't had many changes at
Wow.
all. And I count on them a lot. Our patients do. And they have lots of experience. So I love working with them and treating our patients the way they would like to be treated, or we
Well,
would
that
like to be treated as well.
well, that loyalty speaks volumes. It's quite an accomplishment, and no doubt your patients feel that and appreciate that the minute they walk in your door.
They do. Some people say it's a little bit like Cheers. You know everybody, everyone knows your name. And it's very pleasant and quite frankly, different from most dentists or physicians' offices. So I'm glad to have them and they're glad to have me, I think.
Well, we're gonna meet some of your patients. We're gonna see some before and afters, and I can promise you this: there's no Cliff and there's no Norm at this point. But who do we have first?
All right. So our first patient's Ralph. And Ralph actually was brought in by his wife who said, I sit across the table. I think we need to do something. He had actually seen us on this show. And we did some gum contouring where the laterals were back. Those are the two teeth next to the middle. We reshaped the lowers. We did 8 porcelain veneers to give him a beautiful smile. And subsequently, we'll do some more work on his lowers so that it looks even and looks terrific. But
That's
he loves
incredible.
the answer. He loves what we
What
were able to accomplish.
what a transformation!
And I should
Incredible. Okay,
mention his wife enjoyed it too.
no doubt.
Marcia. Yeah. So Marcia had some crown work done years ago and the teeth had split. And she talked about should we do orthodontics, that sort of thing, due to the bone level that she had. We thought we'd be safer off just doing 4 porcelain veneers, reshaping the teeth, bringing them in to give her that beautiful smile. She wanted to match what she had. Joe, I have some people want big and white, and some say I want natural to match what we have. So
Hmm.
we're able to do that with 4 teeth, close the space, bring them back to give her that beautiful smile that she's comfortable with.
There's nothing worse than seeing something jump out at you like two teeth that don't match, but you make sure of that. That's just beautiful. Everybody gets along. Let's put it that way.
Thank you. That's very
Yeah.
nice. Yeah.
Okay, so
So this
explain
is
this. What's
Yeah,
happening
so
here?
this is interesting. So Matt had what's called decalcification. You can see the white spots on his teeth. The other thing in the before picture, you can see he had an eye tooth that was erupted in that position. He's in business, didn't want to go through braces, and that's very difficult to actually pull that tooth down. So actually that tooth was taken out. We did porcelain veneers on the top, extended around his smile, did 8 teeth and gave him that beautiful smile. And now he meets with people and he's very proud of what he was able to accomplish.
No kidding. Looks like two different people. All right, and who's next?
So this is Sharon, and Sharon was always bothered by the way her teeth looked, uppers and lowers. We started on the upper, we raised the tissue with some gum contouring. She said, listen, I want bright teeth. These have always bothered me. And so we did 10 porcelain veneers on the top. And this year, Joe, and we should be able to work on the lowers and give her a smile that matches. And this was a lot of teamwork. My team and the lab is also my team, the artists at the lab. So our team really consists of a lot of wonderful people.
That's awesome. We have time for one more patient. Wow, this is another transformation. Look at this.
Yeah, so this is Fred, and Fred was in his 60s. He was hesitant to do very much about his teeth for years. He had seen something we had done, and he said, I really would like to improve my smile. And so we did porcelain veneers, just 4 in the upper front. On the lowers, Joe, we just reshaped him, did some bonding to give him that beautiful smile. And he said he should have done it 40 years ago. He's retired now. He had a little more time in his schedule. We were able to accomplish that literally in 2 appointments with this wonderful team that I have.
Well, if you'd like Dr. Marsh and his experienced team to help you out, Doctor, I'm going to give a phone number out. Who should they ask for?
They can ask for Karen, Alicia, or any one of us would be glad to pick up the phone to help your viewers out.
Well, don't wait. Come on. Dr. Marsh has said he hears it more probably than any other phrase. Why did I wait so long? Don't wait any longer. Simply call 440-461-1003 or log on to the website. You can get there too by going to clevelandsmiles.com. Doctor, as always, thanks to you and your team.
It's our pleasure, Joe. Thank you.